dear chair, dear colleagues. My name is András Kubik. I'm a trained urologist and a PhD student in my second year, and I usually take care of bladder cancer patients, so my vision is to empower patients through excellence in the care they receive from me, and I would like to provide high-quality care for these people. So we investigated two topics related to bladder cancer. The first one is investigating MMP7 as a prognostic biomarker in urothelial carcinoma. That was a combined registry with a systematic research and the meta-analysis. And the second one is a comparison of radical and organ-sparing treatment modalities for non-metastatic, very rare small cell bladder cancer patients. So this is a combined registry and the meta-analysis, and you have to know about urinary bladder cancer, which is the second most common urological disease in the world, and with more than 200,000 deaths annually. And most of the cases can be treated transurethral with a minimal invasive method for non-muscle invasive bladder cancer patients. But about 30% of the cases has to be treated radically with radical cystectomy, lymphadenectomy, and perioperative chemotherapy. And despite of these big procedure, only half of the patients will benefit for this procedure, and they will die within 2 years. So there are a huge need for biomarkers. And our aim is to assess the prognostic role of one of this kind, this MMP7. And why MMP7? These matrix metalloproteinases are involved in cellular processes relevant to tumor growth, to angiogenesis and apoptosis. And these functions suggest that these enzymes could be good diagnostic, prognostic biomarkers, and could be therapeutic targets as well. So it has been shown in the literature that these elevated levels are associated with lymph node metastasis, also in tissue, serum, and urine. And its prognostic value have been validated in different patient cohorts. And these MMPs are in the top 5 enzymes, and they have prognostic value. So we drafted the next clinical registry question. Do patients with elevated pretreatment MMP7 levels have worse overall survival rates? We used the PICO framework for muscle-invasive bladder cancer patients, and pre-treatment MMP7 levels were measured. And we hypothesized that muscle-invasive bladder cancer patients with lymph node metastasis and high MMP7 levels have poorer prognosis. And the clinical implication would be that these MMP7 helps to find optimal treatment for high-risk bladder cancer patients. We performed cohort analysis. This first retrospective cohort was from Essen, from Germany, with 87 muscle-invasive bladder cancer patients, and we measured overall survival, and you can see that high MMP7 level patients had worse overall survival. And the second retrospective cohort was from Hungary, from the Semmelweis University, with 68 muscle-invasive bladder cancer patients with the same conclusions. So as you can see our results, we can conclude that patients with preoperative high MMP7 levels have similar poor prognosis like patients with lymph node metastasis, and these patients who does not have lymph node metastasis have similar poor prognosis. So there is maybe possibilities for undetected micrometastasis. We drafted the next question for the meta-analysis with the same clinical implication and with the same hypothesis, and we had more than 400 articles with 6 eligible full text, and our main outcome was overall survival, and the hazard ratio of 2.69 meant that the probability of mortality was 2.7 times higher in patients with elevated pretreatment MMP7 levels. So our strengths are that this was the first meta-analysis regarding the MMP7 levels, and we also perform an additional post-hoc cohort analysis regarding the surgical decision making. That means for for patients without any metastasis, we wanted to know if they need any bigger lymphadenectomy, that means limited or extended lymphadenectomy, and we wanted to conclude if there is a need for bigger surgeries. These were quite homogeneous populations, but we also had limitations regarding the different cutoff values, serum plasma levels. So for summary, we can conclude that MMP has a prognostic value in higher grade urothelial cancer patients. These muscle-invasive bladder cancer patients with lymph node positive disease and high MMP7 levels have poorer prognosis. And the implication for practice is that we should use these biomarkers, and the determination of MMP7 may help to identify patients who need treatment intensification, and preoperative MMP7 levels help to identify undetected lymph node metastasis in bladder cancer patients. And the implication for research would be that these targeted MMP7 inhibitors could be good for therapy as well. So we submitted our paper in April, and it was published in a D1 journal in April. So the second one is a comparison of radical treatment and the bladder-preserving treatment for rare small cell bladder cancer patients. These bladder cancer patients are treated individually, so there is a huge need to find the optimal treatment for them. And as we use the EU guidelines, and there is no strict recommendation for this, and these patients can be treated individually, we want to show the best treatment, and that's why we choose the PICO framework, and we drafted the following question: what is the optimal treatment for these patients? And we hypothesized that this radical procedure, the radical cystectomy, did not influence the overall survival of these non-metastatic small cell bladder cancer patients. With more than 1,600 articles and 5 eligible articles, our main outcome was overall survival, and we found that the hazard ratio of 0.83 means that the bladder-preserving therapy can be better, or it can be with the same efficacy like the radical procedure, and this data is clinically relevant for us, and we would like to publish this article in this month. So as summary, you can see your first finished article and the second one still in progress, and I would like to close my presentation with my motto: you miss 100% of the shots you never take, from Wayne Gretzky, and thank you for your attention.
Thank you for the presentation. I have a question regarding your first topic. So I was just wondering, what was the source for the patient-level data there? Because, I mean, it's rarely available.
The data for the MMP7 levels?
Yes, in the first topic. So not the meta-analysis, but the patient-level.
Yeah, this was analysis. 2 cohorts. One from Essen. It was from bladder cancer patients treated by the research team or by the doctors in Essen, and the second one is from the Semmelweis University, from serum and plasma samples from these patients before surgery, and in our second cohort after the surgery as well.
But are these openly available data sets, or you need special permission to analyze these?
Yeah, we are collecting them, so we have these oncobank, and we have these samples there, and we measure these samples earlier as well, and these prognostic values of this MMP7 has been validated earlier in different samples as well.
I'm just wondering, is it possible to use this MMP7 for follow-up, or just as it is used for a prognostic factor?
Yes, for prognosis we checked it.
Yes.
We found that these levels after surgery are elevated, and these are associated with the lymph node metastasis and with overall survival of these patients as well. So patients who has these elevated levels may have undetected metastasis. So for earlier chemotherapy or treatment, they could be used.
And, is it decreasing after the chemotherapy or no? Or do you know?
So after surgery, it's decreasing.
So are you a trained urologist? You are performing these surgeries also yourself?
Yes.
How would you use this, when and how would you use this marker, and which decisions would be done based on the results?
So before surgery could be used for detection of undetected metastasis and to perform extended lymphadenectomy, or later if we may use MMP inhibitors for therapy or targeted therapy, that would be a good choice later. But after surgery, if the MMP7 levels are elevated and we cannot find any metastasis with CT or PET-CT, maybe have to give these patients early chemotherapy or systemic therapy, and that would be a good choice.
Okay. Would it change your surgery technique, or what you would choose, a higher level or lower level?
The surgery technique would be, yes, we could choose it. So for lymphadenectomy, we perform an extended lymphadenectomy. In that case, if the elevated MMP7 levels are detected before surgeries, or not only radical cystectomy, rather than extended lymphadenectomy.
Thank you. And you were speaking at the beginning about urothelial carcinoma, but afterwards you changed to bladder cancer. So urothelial carcinoma can localize in the bladder and also in the upper urinary tract.
Yes.
Did your analysis included both of these entities or only bladder?
Both of these entities. So upper tract urinary carcinoma was included as well in the meta-analysis part. So, and we found there that there is a higher mortality and worse overall survival for these patients with elevated MMP7 levels.